I'm a psychiatrist, and today we're looking at fictitious disorder. It's a mental illness where a person pretends to be sick. They can pretend to be sick medically or mentally. A person can pretend to have diabetes, and they can even tamper the test results to look like they have diabetes. A person can pretend to have cancer, and they can tamper with the results to look like they actually have cancer and get treatment for cancer. A person can pretend to have schizophrenia and be willing to be put on treatment for schizophrenia, to be treated as a patient who is schizophrenic. So they can pick any illness, even surgical. They can pretend to have appendicitis and they're willing to go to surgery to have the appendix removed. They know very well that these symptoms they are faking because they're intentional and they're aware that they're faking them. They're manufacturing these symptoms. They can even impose injuries on themselves. They can hurt themselves so that they can go and seek medical attention for the injuries they inflicted on themselves. So these people are in and out of hospital. They're aware of what they're doing, and they're doing it as a response to an emotional distress that they're experiencing, but they don't know where it's coming from. So they're not getting medical attention so that they can get compensated or rewarded or get out of responsibility or work. They're not doing it for any external gain. They're doing it for an internal psychological gain that they are not even aware of. There's a motivation underlying all these behaviors that they don't know about. And so fictitious disorder, a person can do it on themselves or they can do it on other people. And we often see fictitious disorder by proxy, where a mother does it on their child. So you find a 1-year-old being taken to hospital 20 times a week. The mother is convinced or wants to convince the pediatrician that the child has a respiratory problem, despite being reassured. Or you find a young person, maybe young adult, imposing it on their mother. So they might fake lab results to show that their mother has a long-term illness or has cancer, for example, or some other illness. They know that they're doing this intentionally. They're very aware when they're doing it, but they just don't know what is driving them. And so these patients would go to so many doctors. They would endure so many procedures and surgeries, and they would be willing to do that. And the doctors would actually recommend them to see a psychiatrist, but they won't come to see a psychiatrist because for them, there's something that they're gaining from playing the sick role, from being a sick person. And they are not aware what is motivating them to want to become or want to take up this role of being a sick person. And so in therapy, what happens is we comb through your past. And what we are likely to find is that at some point in your childhood or as an adolescent, whatever period in the past, you saw someone, you witnessed someone playing the sick role. You witnessed a relative, you witnessed a parent who was very sick. And when they were sick, people were doing things for them. People were respectful of them. People were giving them attention. People were buying them gifts. People were very nice and kind to that person. And you felt that at that point, you learned that if I want to get that kind of attention, if I want to get that kind of recognition, then I need to play the sick role. They may have learned that unconsciously. So now as adults, when they find themselves perhaps not getting the recognition they need, not getting the appreciation or being noticed or being seen, without knowing, their mind resorts to that coping strategy, counterproductive coping strategy, that for me to get attention, your mind remembers that when I was 16, my mother was ill with cancer and everyone was kind to her. Everyone gave her gifts. So if I play that role, I'm going to be able to gain that attention. So that's the internal psychological motivation that they don't know that is driving their need to seek medical care. So therapy can really be helpful, but also medication, depending on how far this illness has affected the individual's ability to perform their role or their responsibilities.